in. If you want to do roll call or let us know who's not here, I suppose.
Currently, we do not have Board Member Liz Henry, Commissioner Board Member Maureen Rosette. We do have a quorum.
Okay, and they can join in progress, and I hear they might be joining online here at some point. So we will move along, and we don't have anybody signed up for citizen input. For our board reports, for my chair report, I don't really have a long report. I just want to say, though, and thank staff here at the Spokane Regional Health District for a lot of their assistance and input and expertise sharing on some of the mobile food vendor issues that have been coming up in recent weeks, particularly on the city side of things. Just Jessica's work on that and Ray's and Danny's input has been really appreciative. So just want to say a big thank you for all of that. And hopefully it's to be continued and not just to be concluded. So we will continue along. For our committee reports, I don't believe there was any meeting of the policy committee. Is there, and I don't see Chair Brooks for the finance committee. So I don't know if there's any comments that from the committee meeting that anybody wants to share. If not, we will chug along and we can get our budget and finance update here a little bit later. And then from our executive meeting, again, it was just going through our agenda, talking about some of these issues today, a little bit of kind of meeting layout, maybe what the future of our meetings looks like a little bit, but it's just kind of the normal pro forma stuff and getting to know our new administrative officer a little bit. Danny, who is here, Danny Scalise, who's sitting over here with us, and he'll be giving us his update in a little bit. And so with that, we will move into our consent agenda. We'll start off with, well, can I get a motion just to adopt the consent agenda as it
So moved.
agenda?
Second.
All right, so we've got a motion and a second to approve the consent agenda. Is there any discussion on that? Hearing, seeing none. All in favor, say aye.
Aye.
Any opposed? Abstaining? Okay, that's approved. And now we're going to jump into our executive session. And so, Michelle, do you want to read us in?
2. So the board will be in executive session for litigation, potential litigation, legal risks of proposed action pursuant to RCW 423110-1I, and labor negotiation guidance pursuant to 423144. I anticipate 30 minutes, at least to start with, so from 1 to 1:30, or excuse me, what are we at, 1:40
7 to
to 2:10?
107.
Okay, 107. And then attending will be all the board members, legal counsel, Heather Yakeley, who's legal counsel in the litigation matter, Danny Scalise, and I think that, or yeah, wait, and Ray for the labor negotiations piece. Okay, I think that's it.
Okay.
Microphones are going to
Okay, well, welcome back, everybody. Thank you so much for your patience. We had quite a lot to talk about, so we ended up extending our executive session by, boy, an hour, I think, perhaps, a little at a time, but I think it was about an additional hour that we spent. So with that, we will go into our action items, and if there's any motions that are to be made related to our executive session, happy to entertain those, or we can move into 7A. Motion.
Sorry, what was the question about the motion? I was reading.
I'm just asking if there's any motions related to our executive session that anybody
Oh, yeah,
plans
I'd
to
like
make.
to make a motion to, yeah, I move to amend the Board of Health's action taken at its regular meeting on June 26, 2025, approving expanded operating hours for SRHD Treatment Services opioid treatment program to authorize the administrator to modify or roll back the expanded hours of operation as necessary due to budgetary impacts, staffing constraints, and operational sustainability considerations. I that such authority be expressly delegated to the administrator, recognizing that operational decisions of this nature would otherwise fall within normal administrative control, absent the board's prior approval of the expansion, and that any changes be implemented in compliance with applicable collective bargaining agreements, including required notice and bargaining obligations. I further move that the administrator ensure continued compliance with all state and federal OTP requirements and report back to the board on the fiscal and operational impacts of the adjusted hours.
We have a motion on the floor. Is there a second to the motion?
Second.
We have a motion and a second. I've made some long motions in my time, and that's probably the longest of all. With that, is there any discussion related to the motion from anybody? Seeing none, then we will move to a vote. All in favor of approving the motion as stated, please say aye.
Aye.
Any opposed? Any abstaining?
I'll abstain.
I think the motion carries 4-2 to 1. Is that correct?
4 yeas, 2 nays.
All right. Well, thank you very much for that. We will then move to our 7A, resolution number 26-05, concluding the work of the Board of Health Transition Committee following the successful recruitment and appointment of the SRHD Administrative Officer. We had talked a little bit about this, I think, at our exec session, and there was some discussion of whether we actually need to have the transition committee now that we have transitioned and hired our new administrative officer. And so bringing this forward for consideration, because this was a board decision to establish the committee, therefore the dissolution of the committee needs to be made by the board itself. And so opening this up if there is interest to adopt this resolution. Okay, thank you. Dr. Blakowski May, is there?
I'll second the motion.
We have a motion and a second to adopt resolution 26-05. Is there any discussion of the item? Commissioner?
Best for looking at this at the executive committee meeting was just, would it, again, I don't think we have to keep the committee, but maybe the leadership of the committee, myself and Commissioner Brooks, could sit down and just review the process with HR or the interim administrators, just to see how the process went and make sure we document it, you know, the process we went through, just so we have that for the next time. But I hadn't had a chance to talk to Commissioner Brooks, but I'm happy to do that if she wants to do that, just so we have something for the future in terms of a process, how we went about it. And yeah,
I think that's a great idea. God willing, we will not need it for the administrative officer position for quite some time.
hope so.
So Commissioner, you mean the distant future, correct?
Into the future.
But perhaps there's some good lessons learned that can apply in many other positions as well. So
Yes.
I think that's a good feedback. Other comments from anybody?
Thanks to everybody who put the time in for the training.
Thanks to Commissioner Brooks for chairing. Okay, not seeing anything else, so we'll move to the vote. All in favor of adopting resolution number 26-05, please say aye.
Aye.
Any opposed, abstaining? Motion. All right, moving on to our second item, which is 7B, Resolution 26-06. This is quite the long one. I will go ahead and read it, but it's probably hard to understand. Removing Alicia M. Thompson's authority to legally bind SRHD for all contracts and procurements related to federal funds. And number 2, removing Lola B. Phillips' authority to act as a designee in the SRHD administrative officer's absence. And number 3, providing the current SRHD administrative officer, Danny Scalise, authority to legally bind SRHD for all contracts and procurements, including those related to federal funds. And 4, providing the SRHD finance director, Kim Kramar's authority to sign requests for federal grant reimbursement. And 5, providing the SRHD administrative officer, Danny Scalise, authority to act as a designee in the SRHD finance director's absence for purposes of signing requests for federal grant reimbursement. And 6, providing continued authority for the environmental public health director, Ray Byrne, and finance director, Kim Kramars, to act as designees in the SRHD administrative officer's absence. Maintaining three signers. Is there anybody who wants to speak to this? Michelle or Danny, is there any with regards to this?
I think it's pretty much housekeeping, taking people out that are no longer here and putting the right people in so we have depth of authority if we need it.
I'll make the motion as,
Got a motion from Commissioner Watt, second from Dr. Blakowski-May. Any further discussion? Seeing none. All in favor of the motion to adopt resolution 26-06, please say aye.
Aye.
Any opposed, abstaining? And motion carries unanimously. Okay, moving into our reports. Administrative Officer, Danny Scalise, take it away.
I think Ray Byrne is
Oh,
going
is
to,
Ray going to start
we're
off?
going to split this because
Great.
since your last meeting, we've done half and half. So he's got a couple things he's going to say first.
Wonderful. Well, Ray, glad to have you.
There we go. Yep. All right. Just as an update, kudos. We encourage our staff to turn in kudos for staff that have gone above and beyond the daily duties. So we read these at our monthly, bi-monthly staff forums. And then we put that out to staff to choose the top 3, which we then bring to here. You do have a copy in your packet of all of the kudos that were put forward, but I have the top 3 here, so I would like to read those. So the first one is for Asia Richardson. Originally thought to be a media inquiry from KHQ's Haley Guthner, aka Help Haley. She had a member of the community reach out because due to unique personal circumstances, she was really struggling with the process and cost of getting her father's death certificate, which in and of itself was a somber task. Asia Richardson jumped right on it, found out what the status of this death certificate request at DOH, and then took the time to contact the community member and see if there was anything she could do to help expedite the process and answer any further questions. I was so impressed with her commitment to providing excellent service to our community. Turns out, Haley just wanted to get her into the right hands, not produce a story. But she followed up with the community member, and it feels good knowing she would hear good things about our team. So just one example, and Asia is the program manager for Vital Records and Accounts Receiving downstairs. So does a great job down there. So huge compliment to her. The second one is for Mark Springer with our epidemiology department. He's program manager. Mark has been with SRHD for over 25 years, working for many years as an epidemiologist and as a manager for the past 4 years. He steps in where and when needed, most recently supporting the HIV/STI team while we hired a new manager. As of today, April 2nd, Mark added the immunization and preparedness and response team to his current management position of the communicable disease and infection prevention team. Mark has a gift of being very patient and logical in responding to day-to-day business within DPR as well as with the ramping up of a response. The outgoing program manager wanted to highlight your leadership, dedication to working with the public health system, and the important role you have in ensuring the community stays protected from communicable disease. So, and as we had discussed previously, we had done a lot of shifting within the DPR team. So Mark took on new responsibilities. And so that was a great effort on his part to step up and take that on while we were searching for the new program manager. And the last one is for Kim and myself. So a little bit humbling, but much appreciated to be recognized. So kudos to Ray Byrne and Kim Kramars for their role as interim administrators since September. Both already have a lot of responsibility as division directors, and their new appointments added a lot to their plates. They both have handled the extra responsibilities exceptionally well with professionalism and expertise. Thank you both for your leadership and guidance during this busy time for SRHD. You are appreciated very much. And that is it.
Can we just give a round of applause for both Ray and Kim and just thank them for stepping up and leading this organization when we needed them to?
I don't want to take up too much time, but I do want to say that you'll start to see some changes that are here. Most of them are going to be in the way things look and the culture that's here. For the next year, that's what I plan to work on, is the culture of this organization as well as the environment we're in. One of the things that I've spoken to the chairman about and will be asking you at the next board meeting, so if anybody wants to volunteer, we'd love to. I'd like you all to create a committee that looks at our facilities. This building, I'm told, not everybody in Spokane likes it, but I like it a great deal. It is 50 years old this year. I turned 50 in a few weeks, so that's how I knew exactly how old it was when I saw the plaque on the outside. And with a 50-year-old building, you have some maintenance issues. We have a fantastic maintenance team, but I think there's some things, not this year, but in 3, 5, or maybe 10 years, we're going to need to spend money on. So I would prefer have a small committee that meets regularly, not too often, to talk about those issues so we can update you on them, so that when we come and say we need a membrane roof, which in a building like this is probably about $1 million, you'll understand, we'll have seen, we don't need that right now, by the way. We're in pretty good shape. But I'd rather start telling you about these issues now and tell you what the life cycle of these are so that you can make decisions. And I know you're not all going to be here in 10 years, but you can start making decisions to prepare for things that will happen 10 years from now, 5 years from now, and 3 years from now. So you will see a lot of the differences in that before we start to work on other things. I think the other thing is we are some Class A hoarders here, and we have a lot of junk that we need to get rid of. So we will start getting rid of some of the stuff that's here. We have some documents that probably should have gone already. And we have things that nobody can identify, like there's plastic molding pieces downstairs that had enough dust on them you could plant corn. So I think we're going to start to get rid of some of that stuff to clear out the clutter that's here. If you haven't been to my office yet, you'll see that I don't like clutter. It's a little more sparse than what my predecessor was. So you will start to see that, and I'd like some of you to come into the building, not every month, but at least quarterly or at least every 6 months, so that we can start to tell you about those issues, and you can listen. We have an engineer for our building supervisor, which is a blessing for us. So having Travis and his team here and being able to have him talk you through what our chiller is doing, why we're doing this, why we're doing that, what maintenance we need to do on the outside of the building, so that you're not surprised by large capital expenditures that come your way, or a future Board of Health that come their way. So please start to look for that. And if anybody wants to volunteer, please call and let me know. We will be asking for a few of you so that we can talk about those issues. I think the other thing, culture is going to be a big deal for me. Because of the turnover in this position, there's just been a little bit of a culture shock here, and the staff doesn't really feel loved. And I think that's just something that we just need to tell them. And nobody's told them that for a little bit. There's nobody been in my office long enough to be able to show that. So I plan to spend a lot of time building a culture of teamwork, a culture of hard work, but we also take care of our families and take care of the things we need to take care of. We have a lot of meetings. Some of those are probably going to get killed because we have everybody in every meeting, and it doesn't really accomplish much of anything. So some of those changes are a little hard for the staff. I've given them a goal of being paperless in 5 years, and I've started to take away printers, and that's been a little hard. So the first printer I threw away was the one in my office. So I would show that I would walk to the big printer when we do, but we pay a lot of money for software to go paperless. So some of those little things don't seem real important, but over the next few years, they'll be much more important. They cut down on some of our risk and cut down on some of our long-term issues that we may see. The thing that we'll have to bring to you later on that we can just start dealing with now. So other than that, I really appreciate everyone has been wonderful. Spoken Nights, I believe is what we called. Everyone has been wonderful, and my house was finished yesterday. I closed on May 8th. So I will be happy to be here and be full-time. I'm living in an apartment right now, and my wife is still in North Carolina. I'll be really happy to see her and my dogs. So we'll be through that process here in a few weeks. And in the meantime, my card is with each one of your seats. It has the cell phone number that you can reach me on, my email address. If you need anything, if you have a question about anything, please call, text, tell me you want to talk things through. Commissioners, you all are right across. So I came and met you yesterday just because it was real easy to be able to walk across there. So if any of you want to spend time here, want to see things that are in the building, or want to get to know things, please call me and let me know, and we'll make sure that that happens. With that, I'll take any questions from you.
Annie, I'll just really quickly say I failed to say in my chair's report, but intended to, that the bylaws do allow me to create committees, and so I am directing the creation of a facilities committee to meet at least quarterly or more frequently as we need to. So
Thank you, sir.
And so if we need to approve appointments to that, we'll do that on the next agenda. And if not, we'll do it unofficially, but please let me know if you have interest. I think we'd like to get at least 3 individuals to join that committee. Please let me know on that.
I do.
Thanks, Patricia. We've
I
got
don't
one.
want to displace anyone else. So if there's someone who's new here and
Oh,
We
no,
can
the
have up
more
to
the
5,
merrier.
so
Like
I
I
think we're
figured there'd
okay.
be some people with that voyeuristic that want to see behind the scenes on everything that's here. So we'll take anybody that wants to come and be a part of it.
Any questions or comments for? Okay.
Thank you.
Thank you so very, very much. We really appreciate it. Next up is our finance update. Thank you.
I went backwards. Okay, good afternoon, everyone. I'll make this brief. I know we're over time. However, I would like to share final numbers for 2025. Final to the extent that we have not been audited by the state auditor's office. They're scheduled to come in June, so they're subject to maybe an adjustment, but I'm not anticipating anything that would be material. And if it was, I would bring that back forth to the board. And then I'll touch on the March 26 financials just real briefly. So a snapshot of 2025, we had a $57 million budget, and I'm happy to report we spent 98.59% of that budget, and our revenue was at 98.78%. So significant budget, but we stayed within both expenses and revenues. Overall, we're at a surplus to the fund balance of $107,000. So that's a reflection of everyone's hard work in the programs, the managers and staff really watching and monitoring expenditures and monitoring the revenue that comes in. So kudos to everyone on that process. Our reserves, as a reflection of the end of the year, our goal is always to be 20% of the unassigned in the unassigned account for reserves of our $57 million budget. So at the end of the year, we're actually at 14.98 million, which is 26%. So we have surplus in our unassigned. And that was board's decision as far as what would be our target for unassigned reserves. And that was set some years ago. We still have the $1.5 million in our committed fund. Board action is required to dip into those dollars. So I would bring forth if we ever had a need to use those dollars. COVID was an example, and then we quickly replenished it as soon as we were able. Assigned reserves are dollars that we anticipate will need future resources. And so when we have two buildings, 8th Avenue and the College Avenue building, when we received ownership of the building, we established a $500,000 per building, just in case something completely unexpected. So we thought that was good to have on hand. Building projects, we've done the roof, we've done windows, we've done the masonry work, and we still have some ADA improvements to have in place, and then also discussion on what to do with our skylight and the firewall doors that are down in the center of the building. So that would be a great topic for the new committee to discuss. But we have set aside, we're at 810,000 remaining from the previous year of funds for that project, separate from the $1 million. Software and system upgrades, we're still working through the Acela upgrade to cloud, and implementation just recently went live. We're piloting with some establishments now on that process. So there's still some dollars to go against that upgrade. And then also we have the EHR new software system in treatment services, and we'll be using some of those reserves. I'm expecting to have leftover money, if you will, and we do have a project in the future to reevaluate the current HRIS system and then the finance and payroll system. So that's a big project. Something similar to the Workday project, but I think on a little bit smaller scale, and we don't have a budget quite that size, but that is in the near future because we do have an end of life on our financial package as of 2029. So that's in the future. And then, as I've mentioned before, environmental public health, we establish our fees based on a cost reimbursement or covering our costs without a profit. And so if we do run a surplus in any given year, we set aside these dollars and they're used for budget development in the following year. And that's how we pay back the establishments, by keeping those fees pretty stable. And so, and then the last part here, treatment services expansion. These dollars were set aside when we had the discussion. There was a year that treatment services ran a surplus of 853,000. And so the 850 was set aside to help some of those front end costs with the expansion. And then if we needed to dip into those, they're available. 2025 is when we started the expansion and started adding new staff, but we were able to, treatment services was able to cover all costs. And they actually ran a surplus of about 100,000 for the end of the year. So we have not touched the 850,000. And overall, our total reserves are 20 million, just over 20 million for 2025. And then in your packet, I have the March financial statement or financial report, and we would be at 25% of budget, and we're running 21%. So I'll just kind of defer if there's any questions to the March report. Otherwise, my presentation was focused on 25 year end. And we're wrapping up annual reports preparation by May 30th. We're on target to have that filed on time. Audit will start in June, and then we start our budget for 27 in July. So busy times.
Okay. Any questions for Kim? Thank you very much.
Thank you.
Dr. Velasquez, Health Officer report.
Good afternoon, everyone. I'm happy to be here. So with the chairman's permission, I'm going to contract my presentation somewhat and refer to the written materials that you have in front of you, just give you the highlights, because we have a very important presentation after me from our food service. I want to make sure we have the opportunity to hear about. So I'll give you the highlights, and you have all of the information in the packet. Couple of things I want to talk about. First of all, I want to highlight that is Mental Health Awareness Month, and that is important, as you know, in our region, as it is in the rest of the country. Mental health has been a concern, and although we're doing a lot, we still have significant gaps in access and providers. So I just want to say thank you to all of our providers in the region for the great job that they do, including some of our own counselors here that work very hard. On the communicable disease front, I want to give you an update on a couple of things. One is measles, which has not gone away. We have about 1,800 cases total in the U.S. thus far. We have 37 in the state of Washington, only one in Spokane. Shout out to the team here that has been very assertive in every time there's an exposure in doing the disease investigation, as well as providing all of the post-exposure treatment and so on and so forth. But it continues to increase around the country, around the world. And the CDC released an advisory in terms of travel. As you know, we're getting to end of school years and people are going to start traveling. And if you think about it, and you have that in your packet, we're part of the North American continent. So we do have neighbors on the south, and Mexico, according to the Department of Health, is about 10,000 cases, give or take. You have the numbers in front of you, and our friends in Canada up north have about close to 1,000 cases. And if you look at the geographical spread in the maps, it's actually closer to where touch points are for both countries. The reason why I bring that up is because those are common travel destinations for summer and breaks and after school and so on and so forth. So it is important for everybody to be aware of their immunization status, and please check if you're going to travel what the status is in that particular country. So with that, I'm going to move on to respiratory illness. Good news, our respiratory illness season is trending down. If you look at the numbers for the flu, for influenza, particularly in hospitalizations, we had one of the most severe flu seasons in many, many, many years in terms of severity of disease, emergency room visits, as well as hospitalizations. And if you recall, we had mentioned that we have a highly mutated variant of influenza A, the H3N2, that is causing a little bit more severe disease. The good news, all of those are coming down, but we're not out of the woods for probably a few weeks yet, so be mindful of that. So with that, I'm going to mention two other things that are up and coming. One is we started to hear about bats not that long ago. And the reason for that is, as you know, in April, the bats start to become active. And between April and June, most people start, everybody has a lake house. I don't, but lots of people do. People start to open their cabins and their various other facilities, as well as go camping. So we're starting to hear about encounters with bats. And as you know, in the state of Washington, bats are the main carrier of rabies. We have 15 species. 4 of them are exclusive to this region. You have pictures in there in the event that you see them. And there's a picture there of a woolly looking one. The point of that one is to tell you, if you see a bat, leave it alone. If you need help, call us. And if you need to remove a bat from your house, there are ways of doing it safely, provided there has been no exposures, and there's resources for that. In addition to that, if there are exposures, we do have post-exposure treatment, and those in high-risk occupations can be immunized if needed. And that includes not only animal control, but for example, cave explorers get typically immunized for rabies beforehand. And in addition to bats, obviously ticks are out. We're going to have a fairly severe tick season, and that has to do with a warm winter. The warm winter is very auspicious for lots of acorns and pine cones. And if you have any pine cones and acorns like we do in our property, you know you've been battling a losing battle with them. The reason for that is it's an overage, and that promotes rodents, and rodents are the vehicle for ticks. So if you start to go outside, please check yourself. You can use insect repellent. Check your pets, particularly dogs and cats, if they go outside. And if you do have any ticks, please remove them completely. Don't leave any pieces in your skin. And make sure that you talk to your provider if you think you have been exposed. One of the concerns we have seen an increase of the presence of diseases that are not as common, but are becoming more common in the ticks that we're finding. which one of them is babesiosis, which is a parasite, and the other one is Powassan virus. Powassan virus, discovered in Ontario town of Powassan, can cause fairly severe disease, including meningitis, encephalitis, and so on and so forth. Anyway, something to be mindful of. I'm going to stop here and see if there are any questions. Yes, ma'am.
Are marmots a concern?
Not a big concern in the state of Washington. I'm glad you brought that up because here we focus basically on the bats for the most part. And in the state of Washington, we have very strict laws as to what could be a household pet. That's why they mention anything beyond dogs, cats, or ferrets. But other parts of the country, you can have as domestic animals something that could be a little bit wilder, like tigers, lions, bears, et cetera, which we are totally different concern. But it's true. The laws are different in every state. So, but here we have requirements for what we allow as pets: dogs, cats, and ferrets. Good question. Any other questions?
Else?
Well, thank you very much. I appreciate your time. And now move it on to Jessica. I may have to forward this, so please don't get dizzy.
Where's your bat?
That one? Or no, that's the one that I like. If you see that guy, leave it alone. He's grumpy. There you go.
Thank you. Okay, so I just got to get my bearings here for a second. So I'm going to give an update on the unpermitted food vendors. I spoke with the board in October of last year about this issue, and I'm going to recap that real quick for those that weren't here then. So basically at the board meeting in October, we discussed what an unpermitted food vendor is and the requirements in the Washington State Retail Food Code to hold a permit, the health district's enforcement capabilities and limitations. And then we talked a little bit about some strategies that we've used. For example, the license plate readers that we worked with Michelle on, and we got some license plates and some cease and desist letters out because of those. And then at that board meeting, we also had a suggestion to form a task force, and we did form a task force. So part of that task force was representatives from the health district, which was myself and the technical advisor. Spokane chapter of the Washington Hospitality was present, some City of Spokane officials, Spokane Sheriff's Office, the fire department, the prosecutor's office, code enforcement, mayor's office, commissioners, food establishment owners even were there, and that was really fantastic to hear from them. Spokane Valley Police Department. So we did meet 3 times. We met in December, January, and February. We hope to meet again, but during those meetings, we basically just discussed some of the regulations that we all have and possible strategies and some discussion about enforcement authorities. And then I do have some pictures. So the pictures on the left they're called red carts. The red carts are mostly in Seattle. They are unpermitted hot dog vendors that usually hang out around the Seattle stadiums. According to this article I read, those red carts will be lined up and outside of Seattle stadiums, and nearby food vendors that are permitted are the 75% of their business in this article was said to be taken from them because of that. So it's unfortunate. That tamales on the truck there was in Spokane. We did send a letter out to that person. And then the fruit vendors, you'll see them all over Washington State without permits. The one on the right is a production center, an outdoor facility to prepare food. It's in King County, but what's interesting is if you look on that picture, you can see a bunch of distribution trucks and vans. And the picture on the top left-hand side is one in Spokane, and so you can see the same vans. So we do predict that the trucks are being, transported across state, probably, and those trucks don't have refrigeration and things like that. So this is, a big problem. So I have spoken about an emergency rule that Department of Health and State Board of Health were thinking of doing in light of FIFA. And it was going to be a 120-day emergency rule. They have decided not to do the emergency rule. They decided to do an interpretive statement instead. What the interpretive statement is essentially is taking the language that's already in the code, the Washington State Retail Food Code, and interpreting it for this situation, and also making it a placeholder for code revisions in the future, so that this could possibly be in the next code. So what it did was give us some more interpretation on if the food is from an unpermitted food vendor, that food is considered unapproved, as an unapproved source. Whereas before in the code, it was not clear for that. Unsafe or unapproved food must be removed from distribution. So that is giving authority to remove the food from distribution. But yeah. These are a whole list of Washington state laws that are RCWs, WACs, and they are that give public health and local government authority over food safety, the vending and peddling laws, and enforcement authorities. There are several different ones, LHJs, local health jurisdictions, regulatory authorities, the RA. In Washington, typically the regulatory authority is the local health jurisdiction. I don't know if you want to look at that more, let me know. No, okay. Just to kind of go over some complaints we've received from the public, we use a notification system through the state called Washington State Foodborne Illness Notification. FINS is the acronym for that. And so in 2023, we received 8 complaints about unpermitted food, 2024, 11, 2025, 32. What's interesting, though, is that we don't receive a lot of complaints as a whole about unpermitted food. We think that's because a lot of times they don't realize that either a permit is required or that maybe they already have one. Also, the vendors are open really late at night, providing convenient, low-cost, accessible food. And so we're just not receiving a lot of complaints, unfortunately. But that you can see that they have gone up over the last couple of years. And that's my quick update. Any questions?
Jessica, you had shared previously with are quite contentious, but even from the public, there has been some very contentious, if not more so than with the vendors themselves. And that includes doxing and all kinds of things that are significantly impacting the ability of our folks to do their jobs.
Yeah, it's a safety concern for sure. I've been sending out 3 inspectors when they issue a closure for safety concern reasons. 1 to kind of manage the crowd like you're talking about, 1 to take documentation, pictures, getting the license plate of the vehicle that's associated, and then 1 using an interpreter, discussing the requirement for a permit to the person at the booth. The hard part is that you'll hear this term a lot in this kind of system. It's a whack-a-mole approach is what we're calling it, kind of. And that just means that when we go to issue the closure and the fee, they pack up and then they move down the street and pop right back up again. And so we're having a very difficult time with that. But yes, we have had pictures of the inspectors taken and put on Facebook and different things like that. So it is a little nerve-wracking. I agree. Any other questions?
Can I ask, on the 32 complaints received in 2025, how many of those resulted in an issuance of a fine, a stop working? I mean, because if those come in the middle of the night, if you don't get them till the next morning, they're gone. So, I mean,
That's exactly right.
what's happened of those 32?
So they are documented, and it is in a state system, which is nice for trends and things like that and stats. But what happens is exactly what you said, is that, okay, we heard about them yesterday or the day before. We can predict maybe when they're operating, and we'll send out a team and the next night. And we've had several occasions where they aren't operating that night. And then it was an effort that went to waste. So. But yeah, so I don't have a number for you, but it is very similar to what you just described.
Are there, I mean, in scenario, are there any scenarios out there? Are there any communities that have tackled this, and how have they gone about it? I would assume it's got to take a close relationship with actual law enforcement, I would assume.
You're right.
What type of success are you having here locally with, I assume the majority of these are happening in populated areas. I assume that's their business model, where the most amount of people. I assume that's going to be in either the city of Spokane or the city of Spokane Valley.
Right.
How's it been working with law enforcement?
They came to our task force meetings, and really we're just at the discussion point. There is no plan in effect at this time to, I don't work with law enforcement at this time yet. I can tell you that the other cities have done ordinances where that gives the authority to law enforcement to issue that misdemeanor, because it is in that RCW that was on that page. Everett, the city of Everett has done that. The city of Sela near Yakima. Benton is doing it currently. They're working on it right now. And so really we are seeing that kind of build up with law enforcement help. But in Spokane, we're still working on that.
Commissioner, that gets to the heart of the issue that we've been dealing with in the city, the changes, the reforms, ordinance change.
That was going to be my next question. I know the city is looking at changing some of the stuff. How is that going to impact? I did see SRHD sent out kind of a press release clarifying how it worked, but how do you envision if that's adopted in its current form? What's that going to do?
Well, there is concern, and the city ordinance, I think that you're discussing with the mobile food truck, is that right? Okay. So the mobile food truck ordinance that the city is looking at adopting is dealing with some of the rules around how mobile trucks can operate within the city limits. Removing some of those authorities could impact other businesses. In my thought is that, for example, if you're a restaurant or a permitted food vendor and they have to follow the rules and they have to pay the licensing and they have to do the upkeep and all the things, that there can be an unfair balance. And so that's a concern. And then obviously if authority starts to decrease, then the concern could be that maybe with the unpermitted food vendors that there might not be the help that we need for that.
I made an attempt to add some penalties to the ordinance, basically to say if you're not following the law, which include the health district requirement, would be a misdemeanor, which is exactly what the city of Everett did. In fact, I used their language almost word for word. And we have not voted on the final, but the amendment failed to do so, and essentially was told that because there's not enough complaints, so there's no problem in Spokane, whereas Everett saw a big uptick, which I'm certain was a concerted effort to increase those complaints. But because of that, there's no need to do this. And one council member suggested that just the mere suggestion of law enforcement is the antithesis of public health, and therefore it's not something that we should even be contemplating.
Jessica, as you know, this is near and dear to my heart.
I know.
Is there anything, and I find it disturbing that the council is going this way with taking regulations away, and I believe the first one to say that we need to deregulate. But in a crisis that we're having, in the first meeting I had with you about this, it's not a matter of if, it's a matter of when an outbreak happens. Is there anything that this board and or public health officer can do to combat this issue?
So our enforcement abilities and at the same time limitations are that we issue a closure notice. It comes with a fee. The fee is $450. What's hard is that they go unpaid and they don't stop operating. So we don't have the authority to take someone's food or to take their property. When we're working with a restaurant, there's due process. So there's hold order abilities, where we can place food that we suspect is unsafe on hold, and that gives the opportunity for the restaurant owner or the food truck owner time to determine whether it is safe or prove that it is safe. And so that's difficult here because how would you issue a hold order safely? Where would the food go? And we don't know anything about the food, where it came from, the sourcing, the temperature abuse. We just don't know any of that. We have the authority to ask them to discard it. But then where does that go? I don't know. So, yeah. That's kind of where we're at this moment in time, really.
So in a perfect world, what would you need? A change in law, something this board could do? What would be the end all be all if you had no restrictions?
I mean, I feel I'm already receiving a lot of support, so I appreciate that. I'm receiving support from, Commissioner Cathcart. I'm receiving support from that task force. I think we need to work on a plan next. That should be our next strategy. Is we've discussed a lot about all those RCWs, all those WACs, and where we fit into those, and now we need to figure out how to use them. I think would be something that would be good. But I really don't know.
I have two major concerns. One is the safety of the inspectors.
Me too.
I think it's going to be a matter of time. Again, if it's not an if, it's a when. And my second is once it happens, it's going to ripple through the entire industry. And it doesn't matter. We had Sergio De Leon here, parking in his parking lot, and the headline's going to read, "Someone gets sick at De Leon's." Melissa Green with the Davenports had him in her parking lot. The headline's going to read, "Somebody gets sick at Davenport," and it's just going to ripple through. And it's only going to get worse with FIFA. It's literally only going to get worse. You didn't show pictures of those carts lined up, but they're happening across the state. And I sit with my my job with the association, I sit in all of the health departments, and it's verbatim what you're saying.
Mm-hmm.
It's going to get worse. So to me, it's frustrating what's the answer? Do we need to go and do an ordinance? Do we need to meet with the police chief and have someone assigned?
I mean, I'm willing to talk to anybody, that's for sure. So if I've sat down with several groups, I go to some of the same meetings you do, and you probably have heard some of the limitations everybody's having. So it's a matter of figuring out how to get past that into a planning stage. Yeah.
Marketing campaigns that are
We did a food safety month last September, and we focused on that across the entire state. Washington State as a whole decided to use that food safety month to do that. So we did do that back then. I recently spoke about this to some of the media, and so some of it hasn't come out yet, but so I'm hoping it does, but sometimes they don't, so I don't know. So we'll see.
Dr. Velasquez, have you done an op about this subject?
No, I have not, but certainly we.
I've got two things that I think we should consider. So changes in our fee structure has to originate with the administration, but I would love for us to consider a substantial increase in the penalties. We call them fees, but in the penalties for folks who are operating in an unpermitted way. It might be, symbolic in some ways because many of these folks do not pay their penalties. But I do think that right now the penalties are so low. I would argue it's hard to really truly take them seriously. And if we could substantially increase from say 500 to maybe a step to 2,500 to 5,000, I think that would actually suggest that we are taking this very seriously and we want to hold folks to account. And then the second thing, I think, especially with FIFA coming up, I really think we want to do a messaging campaign of some kind that encourages folks to ask for their permit or look for their permit when they're visiting a mobile food vendor in this community. So, they're supposed to post those visibly. Oftentimes just oversight, they don't. So folks should be asking for it, but all of the unpermitted would obviously not have a permit to post. So
Are there restrictions to how much we can charge?
I mean, I will say there are two types of unpermitted food. One like this, where they're doing it purposefully, criminally, and without, any regard to food safety. There are others, however, that just didn't understand the process to get a permit. And then we issue the same closure, the same fee to them as well. And we help them get started. We go through plan review process with them and support them through that process. So it would be hard to, I don't know.
yeah, but I think easily we could establish, if they comply, that there would be a different way of treating them. I mean, we're really talking about the folks that are uncompliant, I think.
Or a
Or
first
with
offense,
steps.
second offense.
Yeah, it would be a step.
Step,
I think.
I mean,
Exactly.
Well, and I would say Jessica's team does a great job of education first before fine. And so I think that's where if we see you again, then it's okay, now you're at $2,500
Or whatever the number is, but
whatever the number is. Yeah.
Yeah,
that's my suggestion.
we do issue closures, and the fee, we are, especially, I really find it extremely important when you're dealing with regulation and laws to be as consistent as possible and to treat everyone as similarly as possible. And so when we issue that closure notice and fee to the person that just, did oops, I didn't understand the process, I'm so sorry, blah, blah, blah. And then you issue the fee to someone who is just going to go set up a block away right when you walk away. So, it's difficult to kind of balance that. So
It would seem like you could do something where they get the fine, but then there is a way for them to reduce the fine if they go and get a license to operate. And then you could incentivize that process and help walk them through the process to some degree if they're willing to have it.
We can explore all those options and bring them back to you so you can know what you would have available to you.
That'd be great. Thank you. Any other comments, questions for Jessica? None? Okay. Well,
Okay.
Jessica,
I
thank you so much.
appreciate you. Thank you.
That. And what do we have here? Just we're at our end. So anything from any board members for the good of the order? Seeing none? Okay, well, we are only 16 minutes over time, so probably longer than that, but thanks, everybody. We're adjourned.